Hi, everyone. I think the stream is live now. Hi, everyone. My name is Rachel Carmona. I am the Executive Director of Women's March, and I am so happy to be talking to you all today, although I wish I were talking about something better. Today, we are going to be talking about defending Planned Parenthood, an organization that's near and dear to my heart, and I know a lot of yours as well. And we are lucky enough to be joined by Alexis Mcgill Johnson, the Executive Director or President, I believe, of Planned Parenthood, and also Timmaraju, who is also the President of Reproductive Freedom For All, formerly NARAL. And so I'm so excited to be talking with folks and to be breaking down what exactly this political moment means and what it's going to demand of all of us to defend our reproductive freedom and rights. So I think without any further ado, we're going to get going. Hi.
Hey, Rachel.
Dynamic duo.
I know, dynamic duo. Rachel, first of all, just thank you so much for pulling the Women's March community together. I've been grateful. I've been in like a half a day meetings with, maybe it's all day meetings with Minnie, talking about reproductive freedom policy and all the things we need to do. And so to close out the day with you and all of our friends who want to defend reproductive freedom and fight for all of our rights, our health, our bodies, is just such a meaningful thing. So thank you so much for hosting us.
Of course.
Great to see you, Rachel, and great to see everybody. And just plus on everything Alexis said. You guys are on the ground fighting the fight. We are at war, quite frankly, and that's what we're going to talk about. So it's really awesome to get everybody on the call and motivated for the fight ahead.
Right. And it's like, it's so critical. I know, Minnie, I've shared with you, I've shared with other folks that, you know, my first job at 15 years old was working at a call center for what was NARAL at the time. And so in my head, I'm really trying hard on the reproductive freedom for all, but also
it's okay.
In my mind, it's like the artist formerly known as NARAL. But when I graduated from high school, I actually worked as a domestic worker for 4 years. And then I went to community college and then, you know, finished up school. And that whole time, my only health provider was Planned Parenthood in Madison, Wisconsin. And so like, this is so important to so many of us. And I feel like, you know, the stories that we hear that are often like, you know, really dire, sometimes just forget about that every day. You know, Planned Parenthood is folks' only health care provider of any kind for a really long time. And so I really wanted to like bring the full nuance of everything that we're fighting for there. Of course, we're fighting for reproductive freedom and rights, but also like we're fighting for a whole spectrum of healthcare for a whole, you know, generations, you know, of folks. So I guess for me, a lot of folks get questions about like, what does it actually mean when they get on, you know, Mike Johnson just got on and said, we're going to defund Planned Parenthood. Can y'all tell me, like, what does that actually mean and look like? Like, how are they going to do this thing?
Right. Okay. So what does it mean to defund Planned Parenthood? And like, first of all, like, again, thank you for, you know, sharing your story and what it means to have gotten healthcare at a Planned Parenthood, to understand what it means for to have a health center in your community that may be your first point of entry into the healthcare system, because it's a critical part of the public health infrastructure. Literally, Planned Parenthood organizations across the country are part of a public health system that exists to provide basic sexual and reproductive health care, and in many cases, primary care and other care that people may need access to. So just starting with the fact that it is care that people need. The majority of the health centers are in rural districts. We serve people, half of our patients are on Medicaid, which means that they use federal insurance that is designed to help people who don't have regular access to health insurance through a employer or a spouse or a partner or a university or college. So it actually is the insurance safety gap that helps Planned Parenthood as a health provider safety gap deliver the services that it does. So when we hear the words defund Planned Parenthood, what we are hearing is the need, what we're hearing people say, they want to take away the money that is given to Planned Parenthood providers, like all providers, providing services, and they want to take away the reimbursement that they should get for providing those services. And that essentially is what happened. And maybe Minnie wants to talk about what Mike Johnson said and where he said it and why we have to believe it.
And it's just to underline, it's not like Planned Parenthood gets a grant or a check from the federal government. Right. They are healthcare providers, like many healthcare providers, who get reimbursed by programs that we should all, as constituents of the, of the federal government, be able to get with our taxpayer dollars. Right. So it's complicated, right? People think, oh, that means they're a political organization and maybe they shouldn't get funds. No, they're the provider of choice, the most trusted brand in healthcare. Mm-hmm. And we should be able to get our healthcare from wherever the hell we want, and our taxpayer dollars should be able to pay for that, right? So Speaker Mike Johnson said he wanted to go after Planned Parenthood funding. He intended to defund Planned Parenthood at the dinner for an organization called Susan B. Anthony List. SBA List, the shorthand for their name, is an anti-abortion political action committee and organization. They are rabidly extremist. They are folks who believe we shouldn't have access to care. They are folks who want to see abortion bans. They want to see funding for fake pregnancy centers. They're as extreme as it gets. And make no mistake, Speaker Mike Johnson is part of that community. He is an activist, evangelical, right-wing extremist, and those are his people. Mm-hmm. So it's not an accident that he made that pronouncement. He just said the quiet part out loud. Mm-hmm. We knew they were coming after Planned Parenthood in the budget. And now he just made it clear. He made it plain. So now we have to make it plain that we understand what's happening.
Yeah. And it's scary, right? Because like, as Minnie explained how we work, like, and for many people who access healthcare, right? You go to your doctor. If you have insurance, private insurance, you go to your doctor, you're seen, and then you sign the paperwork that of how the treatments will be covered. And then your doctor applies for the insurance and they get reimbursed for it. You may pay a copay and then you go home. And if you are getting access to care under Medicaid, same thing happens. The provider applies for the reimbursement, as they should, because they provided the service, and you provide copay or no copay at all, given your insurance, and then you go home. And so it's like, I went to get a pap smear. I went to get a breast cancer exam. I went to get, my heart checked. I went to get something done. And I thought that the insurance that I had that allowed me to do that and to walk away is I'm all straight, and my provider's going to get what they need so that they can stay and continue to provide services. And essentially what he's saying is like, no, we'd rather take away access from like millions of patients who are getting their STI tests, their contraception, their wellness checkups, their breast exams, because we don't like Planned Parenthood for whatever reason, not because this care is paying for abortion, because federal Medicaid doesn't pay for abortion, but because we just think they shouldn't exist. And that's actually what's happening. It's just so demonic.
Well, and frankly, I think, and Rachel, you know this better than anybody, it's also an opportunity to shut down an organization that provides some of the best quality care to the most, diverse communities in an equitable way. I mean, the white supremacy is completely baked into this, right? Mm-hmm. It's not just about politics and the fact that reproductive freedom voters are their enemy in their minds, as opposed to constituents they should serve. It's also about the quality and the kind of care. The fact that Planned Parenthood is a safety net provider, that embedded in their work is this deep commitment to equity. They don't like any of that, right? And you and your members have been fighting and rallying around these inequitable cuts across all these programs. And now we're going to see it targeting Planned Parenthood.
And it's so wild to me, because I think that one of the things that I think has become so normalized certainly decades, but in this MAGA regime, is the misogyny that is baked in and like supercharges the authoritarian approach. And so I really feel like, there are, I was reading, what some of the MAGA members were saying are red lines for them. And they're like, we're not going to cut, this, and we're not going to cut that. And they were all fine with cutting, the healthcare that women depend on, but it can't touch communities that are not perceived to be made up of majority women. It certainly cannot deal with anybody that needs gender affirming care or any of those things. And so it really does feel to me like there is this piece around misogyny and sexism, this attack on women that has become so normalized that it's almost hard to see anymore.
Mm-hmm. Mm-hmm. No,
You know, it's
100%. 100%. Because, right, I mean, what you were naming, it particularly when we are watching democracies descend into authoritarianism, the first thing they do, like textbook authoritarianism, is cut off women's rights, cut off rights for people who are gender expansive, cut off rights to ensure that you can control at least half of the population. And we've watched that consistently. And so that is, you know, normally we're watching that in a world where, or in a country that is actually homogenous. So there's like something interesting happening in this moment, because we are watching the same playbook, but in a pluralistic democracy, in a ethnic democracy, in a racialized democracy. So they have to approach it differently. So we're watching fascism move through a gendered and a racialized lens, through a white supremacist lens, as, you know, as many named. And we've always known, you know, that the people who are least able to be supported under our healthcare in these moments, post-Dobbs, even pre-Dobbs, we're always going to be women and gender expansive folks of color in states that had the worst health outcomes writ large. And this is just another layer of taking, you know, access to federal insurance, of which half of all Planned Parenthood patients get access to, and trying to essentially run this misogynistic and supremacist playbook through. And so I'm so glad that you named that, Rachel.
The other thing I wanted to add to Alexis's description is that I don't know that folks understand that for most folks who need Medicaid, Planned Parenthood is the only place that they can go that will take it in whole swaths of the country, right? So they're literally the safety net provider for so many reasons, not just because they're a welcoming and equitable place to go, because in some cases they're the only place for folks to go.
That's right.
And I think that some of that is that it runs so well that people don't quite understand what's happening. You know, I remember very clearly going to Planned Parenthood. I was cleaning houses at the time. I was a domestic worker, and I didn't have insurance. You know, or if I had insurance, it wasn't worth having because it was so expensive. But you know, Planned Parenthood was my sole, you know, healthcare provider. And so when I would go, I would fill out the paperwork. And I think maybe some people don't really realize that they're filling out this paperwork and then you're getting these services, like they think it's free somehow, or, you know, that there's someone getting billed. But I think that part of also what's going on is we're seeing the connection between these services that, you know, we have that folks have maybe taken for granted. Like, you know, you expect a Social Security check on time, and generally it's come on time. But as you know, the far right is dismantling these fundamental services inside of government, I think we're going to start to see the things kind of fall apart that we have been really unaware are even happening, because they happen so automatically inside of our society. So, you know, so I guess that brings me to the question of what if their agenda got through, what would it look like? Like, what would our new reality look like? Like, what would that be?
Yeah, like, you're making a great point, right? That like, and you're making a great point, because that's exactly what it should feel like, right? Like, people should recognize that they should rather have the experience of being able to go to a provider that they trust, to get quality care that they believe in, to feel good when they leave, and to have a seamless experience where it costs them nothing. Just because it costs them nothing doesn't mean that it's free to provide. And that we have worked hard both to fight, to advocate, to be able to deliver that to people, because we believe that our patients deserve that care, and they shouldn't have to worry about those things, that they should only worry about their well-being. And so creating an environment, creating a health system that allows them to have an experience at a Planned Parenthood health center, to get the care that they need, and then to know that the advocacy to support communities to be able to have their insurance support their ability to do that is exactly what we stand for in all of the work. And it's what all of us collectively fight for. So I think we want to hold that at the center of it. So what would it mean to take $700 million away from a system that is able to provide that care across the country? It would mean that, when you start attacking Medicaid funding writ large, when we start big picture, and then I'll talk about Planned Parenthood. When you start attacking Medicare writ large, you're talking Medicaid writ large. You're talking about attacking rural hospitals. You're talking about attacking the ability for residents and fellows who normally get paid through Medicaid funding as they do their training through these various hospitals. You're talking about taking away access to school districts that leverage Medicaid to, support students who, may have various needs and need more equitable education experiences in order to get the same education across the board. You're talking about taking away access to, elder care, hospice care that some of us have put our, parents and in-laws through. So there is an attack broadly on healthcare through this Medicaid fight that everybody needs to understand. And then you take it down to Planned Parenthood, taking away $700 million, which is, a significant part of our budget that allows us to provide those sexual and reproductive health care services at no cost to patients. And it means that there would be limited access, more self-pay, and quite frankly, we'd have to close health centers in communities where we have built trust, where we have supported generations, where we are actively managing challenging outcomes because of the Dobbs decision. We're actively supporting communities that are facing high maternal mortality rates, actively supporting communities that are managing high spikes in STIs that we've seen really since the beginning of COVID. People who have limited access to contraception, to gender affirming care, all the things that just allow us to be and plan our lives. We are taking away that from millions of patients.
And then I think, in addition to all the services that we're going to lose because of Planned Parenthood, from in the repro space, it's also important to remember Medicaid covers things like births. I was just in Arizona. 50% of births in Arizona are funded by Medicaid.
Right.
Mm-hmm.
So you care about, families. Why the hell are we gutting that program? We're talking about the majority of prenatal and postpartum care. There's Arizona's on my brain because I was just there, but there's data and research that shows since Medicaid expansion in Arizona covered postpartum care, there's been a dramatic drop in maternal mortality. Mm-hmm. So this is a program that disproportionately benefits kids and moms. And our abilities to decide how to have the families we want to have, right? So,
and who we want to be.
What kind of values do we have when we gut programs like that? The other piece of it is, and Alexis talked about this as well, when you lose Medicaid and you lose Planned Parenthood, what happens to all those patients?
Yeah.
They flood other systems, other systems that are already overburdened. So you might think, maybe I don't need Medicaid. This isn't my problem. It's everybody's problem when the entire healthcare ecosystem is broken because of this fundamental resource taken away from everybody else.
Without question. The surrounding systems can't absorb our patients, and they have said so, right? It's very clear that, what we would say FQHCs, the federally qualified health centers, they can't absorb Planned Parenthood patients, nor do they have the same expertise that we have in terms of providing that non-judgmental, high quality care across the board. And when you have to close hospitals, when you have to close health centers, really takes an incredible amount of time to rebuild and to establish the same kind of trust in community. And so it's not we're gonna do this, in 25 and then, at the end of the year, we'll rebuild it if we accidentally cut too much. That's not how it works. You can't doze your way out of healthcare. You have to actually ensure that people have continuity, that they have access, that they have trusted people that they can talk to, that they can communicate with, that they can bring their, the same people that you brought your your mom came to. Like, you know, it need to be the same people that also you can bring your children to, so that they understand kind of who is, you know, representing your best interest and who's helping you be who you want to be. And so I think when you're talking about like setting up healthcare structures and systems to support people, it's not something that you can just like doze your way out of. And that's the real alarming point here.
I'm in Texas, you know, and so when you're saying all these things, I'm like, I don't hear anybody who's not impacted by this. You know, Texas is, I believe, the leader in the world of STIs. I believe it could be Houston, but it should be Texas. I can't remember the exact stats, so don't come and get me in the comments. But let's just say that Texas is really on one with respect to STIs. And then, of course, maternal mortality rate among the worst in the country, if not the worst in some demographics. You know, and then also I know that the Medicare coverage, I mean, I know it's really difficult to even find an OBG. I'm in the Panhandle. I know it's difficult. You know, if you don't have like an emergency, you might wait 6 months to find a doctor, you know? And so all of that is just kind of chilling, because like, who's not impacted? Like
everybody. Which is actually the power that we have in this moment, Rachel, honestly, because everybody is impacted by Medicaid, right? It is it's a federal insurance program that, as I said, you know, not just supports Planned Parenthood, but really the breadth of healthcare across the board that many communities rely on. So whether you're talking about elder care, you're talking about CHIPS, you know, supporting, you know, children and young people getting access to the care they need, whether or not you're supporting public school systems that literally rely on access to this care in order to support their students. And then, of course, all of the healthcare work. So, you know, look, I think that the understanding how the whole health system works, from everything from kind of bodily autonomy that you get through sexual and reproductive health care, to primary care, to elder care, to mental health, all of those things would be impacted by a Medicaid defund. And certainly, you know, as an organization that sits at the intersection of supporting, you know, young folks, supporting women, like literally the backbone of communities that are also then reaching out to support all of those other communities, it becomes critically important. And so, you know, one of the things that I think I've learned just in the last few like months of organizing around this is how little people understand about how Medicaid actually, like they may call it something different in their community. Like Wisconsin, as you know, they call it Badger Care. You know, here we call it Apple Health. You know, some people may be in an ACA exchange, Affordable Care Act exchange, and not know exactly, you know, whatever the name of their insurance program is actually being funded by Medicaid, or whatever program they're using to support their mom or their child is actually access to Medicaid. And so they're trying to isolate Planned Parenthood out of here. But what they're really trying to do is use us as an example. They're trying to defund one of their biggest political opponents, because we are fighting for all of the care, not just Planned Parenthood care, to defund Planned Parenthood in order to save money for tax cuts for billionaires. Like, come on. Like, I can't get my pap smear, but you can get your tax cut. How does that make sense? Make it make sense.
Mars, while you're on Mars.
With your, like, what, 100 baby mamas? I'm sorry. I have to say it.
In your private Texas, like, city, like, get the fuck out of here. So I guess.
But I think but can I just, Rachel, just to wrap that point up, though, that last point, we cannot let this happen. We cannot. Planned Parenthood is, it's everything to so many people, but it's also emblematic of a bigger fight and the crisis we're in, like fight for the soul of the nation. We cannot let this happen. Not on our watch. It absolutely cannot happen. The good news is, and hopefully this is where we're pivoting, is there's something we can do about it. And these Republicans are nervous. They are nervous and they are scared because they understand all this noise Women's March y'all have been making in these swing congressional districts, in these town hall meetings. They are afraid. They're afraid of you. They're afraid of voters. So there's an opportunity, and we don't need that many of them to flip. We only need a couple of Republicans in the House, and they can save this. They can save Medicaid, and they can save Planned Parenthood.
That's right. That's right. Over 70 million people get access to Medicaid. This is going into conversation next week, right? So
I was just going to ask you, what's the timeline?
Okay, so the way this is happening, what we're really talking about right now is the reconciliation bill. Congress actually controls the purse strings, so they are really focused on right now on, building their budget, like many families do. They build their budget on what they can afford, how they're going to pay for it, and the programs that are going to be supported throughout. And so they are in those negotiations right now. We know that they are considering gutting Medicaid and gutting access to Planned Parenthood and all of it, what we explained, defunding Planned Parenthood. They will do it through a subcommittee called Energy and Commerce. And right now is when members need to hear from us. Yeah. There's some things that, in all the crazy that's happening, in all the tyranny and authoritarianism, we still live in a democracy. And we have to treat our democracy and the people who are elected to represent us like they represent their constituents, which means we need to get on the phones. We need to send them emails. We need to send them text messages. We need to make sure that they are all hearing from us that as they prioritize the programs in this budget, that they do not defund Medicaid. They do not defund Planned Parenthood because our communities rely on them. They're hearing from everybody else. They're hearing from big business. They're hearing from their billionaire friends. They're hearing from all the people who want those tax cuts. Mm-hmm. And we have to help them say no to them and yes to us. And that is really what building power looks like. And that's why we're in this conversation right now, this week.
Someone said to me that they need to be more afraid of losing their seats and their constituents than Donald Trump.
Well, we already know we're more popular than Donald Trump.
100%.
Planned Parenthood's more popular.
Abortion is more popular. Birth control is definitely super popular.
Definitely.
Way more popular.
Yeah. Reproductive freedom is way sexier than Donald Trump. We can say that for sure.
It's not too hard.
Is that it seems like, I grew up, I was raised a feminist the way that some people were raised Catholic. Like I was raised by a feminist mother, you know what I mean? And so I was told for my whole life, Roe versus Wade is the law. Like you will always
sacrament, right?
You will always. And then when Dobbs, was coming, even after the leak, people were like, they'll never let that happen, And then it happened, and then everyone was like, surprise Pikachu, even though we knew it was coming, even though we had hundreds of thousands or millions of people, I don't even remember what the totals were out in the streets. And so for me, it's really important that in this time when so often there are, alarm bells, everything is like, an alarm bell. I really, if people are leaving here with one thing today, I would say is let us not repeat the mistakes of Dobbs and think that someone is coming to save us. The bad part for me is there is no cavalry. There is no cavalry.
It's us.
We're in the chat. It's us. It's our organizations. It's the people who are in the streets. And that's the bad news. But the good news is we're enough. We're more than enough. We have people power, and that's the best power. And I know that over 10,000 or 10,000-ish Women's March people have already signed petitions that have gone to their local folks, and also the committee folks who are writing the budget. And so we're going to go ahead and push that link in these things. But are there any other concrete steps that y'all want people to take, understanding that no one is coming? So here's the stuff that you have to do today, this week, every day this week, what have you.
So the bill, they're trying to get to a final bill next week. Their goal is to get this bill finalized by Memorial Day. So we have our timeline, right? It's this month. We have to be active. We have to be engaged. We have to call our members of Congress and be very clear. You are not going to defund Planned Parenthood. You're not going to cut Medicaid. These are programs we rely on. They need to understand that. And even better when they hear your personal stories as it relates to it. So that 100% is the work that we need to do. The second thing I would say is there are lots of resources at imforpp.org, which is short for I'm for PlannedParenthood.org, but I'm for pp.org, where you can plug in, figure out a way to volunteer and engage. And then last I would say is exactly what you said, Rachel, sometimes we have to remind ourselves that we're the majority. that, that the billionaires are not the majority, right? Like they act like it, they throw their weight around like it, but at the end of the day, they also have to submit to being governed. And so we have an opportunity right now in a very short window to ensure that everyone that, has been elected to represent the people of this nation needs to understand what we care about and prioritize our interest and not the billionaires' interests. They were not elected. They do not, they can't rule by fiat. And so we want to make sure that they understand what's up. So go to I'm for PP, make sure they're hearing your stories and say, you're not going to defund Planned Parenthood. You're not going to defund Medicaid.
And you guys are organizers, Rachel, you know this, and everyone on this call knows this. And I'm already seeing it in the comments in the chat. You, in addition to your stories, you have an opportunity to tell your friends and your family to tell their stories,
right,
and to let them know what you learned on this call, that Medicaid, actually defunding Medicaid would defund Planned Parenthood, period. That Planned Parenthood has done X, Y, and Z for me and my family. In my case, one of my first jobs in politics was working for Planned Parenthood, but more importantly, that's where I got my IUD. And by the way, it was painless because I had a top-notch nurse who knew how to give somebody an IUD, because that thing could go really wrong.
Wow.
And I had a really great provider who was experienced and skilled, and probably saved me from a lot of drama for a very long period of time in my 30s. So tell your story, but tell your friends and family to also tell their story, and make sure they understand this fight that's happening in the press right now. The coverage about Medicaid is about the clinic around the corner. Break it down in simple terms. It's about where I got my IUD. It's about where I got my health care. It's where I got my STI. It's where testing. It's where I got my birth control pills. And share, and ask them to share, and ask them to call. So if we each bring 5 more friends, right, we're going to be blowing these people up.
Yep.
Absolutely. And everybody deserves access to high quality, non-judgmental healthcare. Like at the end of the day, that's what Medicaid allows us to do. It provides the ability for all of those people who are, working at Planned Parenthood health clinics, who are working at, rural hospitals, who are working in urban hospitals, like places where, we may feel forgotten, but it allows those people who show up every single day to say, I see you and I need you to be seen. And they are doing the work to make sure that that's the case. And this is how we support that. And that is way more important than giving a billionaire a tax cut on the billions that they clearly don't need.
And the American people are with us. That's the last thing I'd say, right?
100%. Not just the American people, but the Women's March base. Like Women's March as an organization, I think it's safe to say would not exist without Planned Parenthood. I certainly would not be on this live without Planned Parenthood. And so this is my public pledge of Women's March. You have our sword in the fight to come. And so we are here with you. We are pushing all of these pieces, and we are going to make sure that all of our base is engaged in the fight. And I hope that everybody on this call and everyone that sees this later, can take this into their networks that they have, and everyone's in their little, Facebook groups or whatever, Cat Ladies for Kamala and whatever their old groups that they're in, and, go get people agitated and let them know, like, the fight is right now. It's not later. Get active, get moving today. And we'll make sure that all of these links are pinned in the comments. And we will, be out here fighting until we win. When we fight, we win.
Thank you so much for all the support that you were doing. Thank you, Rachel and to Minnie, for being such great partners. I love that this movement is being led by incredibly powerful powerhouses, powerful women who are just driving these conversations for what we need to do in our communities. You're bringing the fire, you're bringing the heat, and I'm so grateful for it.
And I'll just say, Alexis is a goddamn hero. Okay? Heroine hero. Listen. This woman, she's fighting every damn day in the streets and the halls of Congress, everywhere all across the country. She's not resting. She's spending so much time away from her family. So send positive energy and love we got to stand up for our champions. We got to fight.
That's the hidden part. You know, when I say
the
Women's March would not exist without Planned Parenthood, it's not just about the services, it's about the leadership of the organization and the way that it works to be that same kind of support services for so many of the organizations that we know. This is not just an attack on, this isn't an ideological attack. This is a very calculated political attack that is meant to take out one of the strongest foundations of the services that, you know, take care of communities of color, women, you know, trans folk. This is a broad-based political attack that is very calculated, and it has nothing to do with, you know, any of the excuses that they're talking about other than blinding their own pockets. I mean, at least that part is transparent. But I am 100% with you. The comments are 100% with you. So we're going to be doing everything that we can to move this. And the time is now. So it's like, it's shoe leather time.
That's right.
Let's get it on. That's right. That's right. Thank you. Thank you. We're marching. We got our virtual marching on. We got our we got our marching on. So thank you, Rachel. We really appreciate you. And thank you, Minnie.
Thank you all so much. We'll see you soon.